Virchow is a 19th century German pathologist who identified three factors that promote thrombosis. And these three factors are stasis of blood flow, vessel wall injury, and hypercoagulability. And so when one or more of these factors are present, clot formation becomes much more likely. Just to explain each component in a bit more detail. So first of all, stasis. So stasis is where blood is static and isn't really moving normally. And what happens with stasis is clotting factors can accumulate locally rather than being diluted and cleared by flowing blood. And so classic examples of this would be things like immobility, and this can be due to acute illness or travel. But then stasis can also happen in pregnancy, where basically the gravid uterus compresses the pelvic veins, causing a kind of functional stasis. And then we can also have heart failure, actually. So where the heart isn't pumping blood effectively, this also can result in a bit of stasis. Vessel wall injury results in exposure of prothrombotic substances to the blood, increasing the likelihood of clot formation. And so here we think of things like surgery or trauma that directly damage veins. We also have things like central lines or even inflammatory conditions like vasculitis. And then thirdly, we have hypercoagulability. So we've got stasis, vessel wall injury, and then hypercoagulability. And so hypercoagulability is simply where we have an increased tendency of blood to clot. And this can either be inherited or it can be acquired. And so if it's inherited, we think of things like factor V Leiden, prothrombin gene mutation, or deficiencies of natural anticoagulants like protein C, protein S, or antithrombin. But then for acquired hypercoagulable states, we think of things like pregnancy, simply because pregnant patients produce more prothrombotic substances, with the idea being to limit blood loss during childbirth. But of course, the flip side to that is that it increases the likelihood of suffering from clots during the pregnancy period. We also have estrogen therapy or estrogen medications. And so these would be things like hormone replacement therapy, but then also the combined oral contraceptive pill.